Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'll be explaining the fourth anatomy lecture of the wrist block. Inshallah, I'll try my best to make it as simple as possible. All I need from you is to concentrate because this lecture needs a little bit of concentration. So bismillah, let's start. First of all, let's have an overview of this lecture. So this lecture is going to be divided into two parts. The first part, we're going to talk about the nose. Everything to do with the nose, okay? So we're going to talk about the bones that form the nose, the cartilages, the nerve supply, everything. The second part is going to be about the pharynx, okay? So, first of all, we have a small introduction about the respiratory system. So, as we know, the respiratory system is divided into upper tract and lower tract. The upper tract is formed by the nose, the pharynx, and the larynx. So, these three form the upper respiratory tract. Then, what forms the lower respiratory tract? The trachea and anything underneath. Yani the trachea, the bronchi, the bronchioles, the alveoli, the lungs. كل هدول from the lower respiratory tract. يعني the upper respiratory is only formed by the nose, pharynx and larynx, okay? Then we have another division. The other division is conducting zone and respiratory zone. So what are they? What is the conducting zone and what is the respiratory zone? The conducting zone, from its name, it conducts. What does it conduct? It conducts air. So it transports air and conditions air. تمام? What forms the conducting zone? The nose, the pharynx, the larynx, the trachea, the bronchi, the bronchioles, yani basically everything. Almost everything forms the conducting zone up till the respiratory bronchioles. Once we reach the respiratory bronchioles, خلاص هنا the respiratory zone starts. So the respiratory zone is formed of the respiratory bronchioles and the alveolar ducts and the alveoli. تمام? Everything else forms the conducting zone. تمام? What's the function of the respiratory zone? Respiratory zone is for gas exchange. So it allows O2 to go in and CO2 to go out. تمام? Here we can see it in this diagram, it's more clear. So the trachea, the bronchi, the bronchioles, and the terminal bronchioles up till here, this is the conducting zone. After the respiratory bronchioles, خلاص هنا we start the respiratory zone. This is everything I just explained. Now let's start the nose, تمام? Which is the star of this lecture. So here, this is like reading, nothing much to know. Okay, so let's start with the nose. So the nose, we need to know the nasal cavity. We're going to start with the nasal cavity. What's the nasal cavity? It's the cavity or the place where everything goes on. So let's start with knowing where the nasal cavity starts and where does it end. So it starts with nares, okay? Here, the nares, or like the area where the nasal cavity starts, is known as nares, okay? So the nares starts here. The nasal cavity starts from the nares and then it goes all the way till this area known as quana. تمام? So quana is the end part of the nasal cavity, the posterior part of the nasal cavity. طيب. Now let's see a different section, like the coronal section of the nasal cavity. So this is the nasal cavity. تمام? It has a roof, it has a floor, and it has two lateral walls, and then it has in the middle a medial wall. طيب? We're gonna see each one in details. بس مبدئيا كده, or to start with, let's know that the roof, what does the roof do? It separates the cranial cavity from the nasal cavity. طيب? The floor, what does the floor do? It separates the oral cavity from the nasal cavity. And then we have the two walls on the side, and we have in the middle the medial wall, also known as the septum, okay, which is in the middle. We're gonna see how it's formed, or what is it formed of in the coming slides, okay? Now let's start with the roof, تمام? So first of all, let's start with the roof. The roof is formed of, first of all here, number one, as we can see, this one, is the nasal cartilage, okay? So this is the nasal cartilage. Then right after it, we have the nasal bone. So nasal cartilage and nasal bone, okay? Then we start going to the superior part, or to the upper part. What's this part? It's close to the forehead, right? So the forehead is formed by the bone known as the frontalis, or the frontal bone. Okay, so this bone is known as the frontal bone. تمام? So here, the frontal bone forms the roof of the nasal cavity. تمام? So first of all, we said nasal cartilage, nasal bone, and then the frontal bone. تمام? Then we have the ethmoid bone, but not the whole ethmoid bone. لا. A part of it known as the cribriform of the cribriform palate of the ethmoid bone. So this is the cribriform palate of the ethmoid bone. And then the last part here is the body of the sphenoid. Okay, it's also the bone here on the cranial, yani one of the cranial bones يعني. So the body of the sphenoid. So as we said here, we have 4 bones. First of all, we have a small cartilage, which is the nasal cartilage, but then the nasal bone. Then we have the frontal bone. Then we have the ethmoid bone, ولكن not the whole ethmoid bone, only one part of it, which is known as the cribriform plate. Okay, cribriform plate of the ethmoid bone. And the last thing here is the body of the sphenoid. تمام? So this forms the roof of the nasal cavity. Okay, what forms the floor of the nasal cavity? One thing, which is the hard palate. Okay, the hard palate forms the floor of the nasal cavity. So the floor, what does the hard palate do? It separates, or the floor, what does the floor of the nasal cavity do? It separates the oral cavity from the nasal cavity. And what does the roof do? The roof separates the cranial cavity خلاص from the nasal cavity. تمام؟ تمام. Now let's move to the medial wall. The medial wall, as we said, it's known as the nasal septum. Okay, it's the one in the middle. If you touch your nose, you're gonna feel it. Okay, so now we're gonna talk about the medial wall. Okay, what forms the medial wall? We have 3 things that form the medial wall. First of all, we have a cartilage. Okay, which is known as septal cartilage. So we have the septal cartilage, which is the most anterior part. Okay, so this is the septal cartilage. Then the middle part is known as the ethmoid bone as well. We just saw here the ethmoid bone forms the roof, صح? But we said the cribriform plate of the ethmoid bone. Now we have a different part of the ethmoid bone. The other part is the perpendicular plate, which is perpendicular and vertical. So the vertical plate or the perpendicular plate of the ethmoid bone forms the septum or the middle wall. تمام? So كده we have the ethmoid bone in 2 places. The ethmoid bone forms the roof and it forms the medial wall as well. Okay, so make sure you remember which part forms which. And then the last thing we have the vomer, which is the posterior part. Okay, this red one is the vomer. It's a bone, it's just a bone separate كده مع نفسها لحالها. It's known as the vomer. تمام. So كده we spoke about the roof, the floor, and the medial wall. Now let's go to the lateral wall, okay, which is very, very important. Okay, so for the lateral wall, I like to remember it in a story sort of way. Okay, I'll tell you some not mnemonics but abbreviations I made up. If you want to use them, feel free. If not, then you can just stick to the normal names. So here we're gonna consider the nasal cavity as like a room or like a area that we're gonna have some rooms in. Okay, it's like the house. What are the rooms? The rooms are sink, mink, and ink. Superior nasal concha, middle nasal concha, and inferior nasal concha. تمام? I know ink is with a K, but we're going to consider it with a C for the sake of this يعني. What does concha mean? This is just like general information to make it clear or to remember it. Concha, apparently in Arabic, I didn't know that, but in Arabic apparently concha means محار البحر أو صدف البحر. So it means like a seashell. So it's something like this, okay? So as you can see how this looks, if we go back and see the concha we have here, we're going to see that it has a similar shape, right? Or like a similar shape to the seashells, okay? So this is just to remember it. So this is the nasal cavity, the lateral wall of the nasal cavity. تمام? We have 2 sides of the lateral wall, as we know, يعني, because we have 2 lateral walls. So we have this like this structure twice. تمام? So قلنا هنا sink, mink, and ink. Those are the rooms. Superior, middle, and inferior. Between each room, هل معقولة the rooms يكونوا كده داخلين في بعض? No. The rooms have to be separated. So we're gonna have a space here, and we're gonna have a space here, and we're gonna have a space here. Then we need a roof. They can't just stay like this, so we're gonna have a roof. Okay, so we have 4 spaces. So 1, 2, 3, and 4. We have 4 spaces and 3 rooms, okay? Now let's see them in details. So قلنا هنا superior, middle, well, inferior. So what are the names of the spaces? We need to name the spaces. So any space is going to be known as meatus. طيب, any space is going to be meatus. So if superior has a space underneath it, we're going to call it superior meatus. The middle has a space underneath it, we're going to call it middle meatus. But inferior, same thing, has a space underneath it, we're going to call it inferior meatus. What's the roof? طيب, the roof is going to be named after the bones it's against. So we have the ethmoidal bone and the sphenoid bone. So we're going to name it as sphenoethmoidal rhesus. Sphenoethmoidal rhesus. This is the top space, or the top, like the roof of this whole thing, okay? Now, let's talk about, this the same thing I just said, the spaces, the names of the spaces. And this is the spaces like in a clear diagram, I guess, because they cut the sink, mink, and ink, the rooms, they cut them so we can see the spaces in a clear vision, you know. Now let's move to the paranasal sinuses. I think we all know what the sinuses are. We've studied them in the foundation, we've studied them in other lectures as well. Best let's have like an overview about them. So the paranasal sinuses, what are they? They're air-filled cavities around the nasal cavity. تمام? What's the function حقتهم? Their function is to lighten the skull or decrease the skull bone weight. تمام? They also warm and moisten and filter the air. تمام? And what's their third function is? They add resonance to voice. They don't form the voice. لا, they add resonance. Like كانوا بيسووا echo للvoice. Okay? So they add resonance to voice. Now let's see the sinuses we have. We have 4 sinuses. The first sinus is عند the forehead. Okay? Against the forehead. It's known as, because the forehead, as we said, the bone is known as إيش? The frontal bone or frontalis or frontal bone. So this is going to be frontal sinus. تمام? Then we have the ethmoid sinus. The ethmoid is divided into 3 parts: anterior, posterior, and middle. We're going to see them now. Then we have the maxillary, okay, maxillary sinus. And then we have the last thing here on the lateral side, the sphenoid sinus. Tamam? So as we said here, the structures on the lateral wall of the nose. We're still on the lateral wall. This is all with the lateral wall. So these structures are gonna be inserted into the lateral wall, or they have openings in the lateral wall. So we need to know what are the structures or what are the things that are going to go into the lateral wall of the nose, okay? So going in paranasal sinuses, as we can see them here, this is the frontal, okay? And this is the sphenoid, okay? And then we have the maxillary on this side, we can see it here, anterior view. And then we have the ethmoidal, we have the anterior, posterior, and middle, okay? The second thing that's piercing or going into the nasal lateral wall of the nose or the lateral wall of the nasal cavity is the nasolacrimal duct. What is the nasolacrimal duct? It's the duct that drains the tears, okay? So it's the duct that's in charge of the drainage of tears, okay? Now let's see them. Remember the spaces we mentioned between the sink, mink, and ink, between the rooms? صح, we had spaces. So now we're going to see السبيسز هذولي, these things here, the sinuses and the nasolacrimal ducts are going to go into these spaces. So we need to know which duct or which sinus goes into which space. Okay, so we're going to see now. First of all, we have the sphenoethmoidal recess, which was the roof. Remember, which was the roof? It was above above sink, which is the superior concha. Okay, so it was above it. So what goes in, or where is the opening for what structure? It's the sphenoidal sinus. تمام؟ لأنه من اسمها sphenoidal ethmoidal recess فحيدخل فيها sphenoidal sinus. تمام؟ Then we have the ethmoidal sinus. We said the ethmoidal is divided into posterior و anterior و middle. So the posterior is going to go to the superior meatus. Superior meatus هو اللي فوق, اللي هو هنا. Let's go to this diagram عشان يكون أسهل. Where is it? Here, the superior meatus. We said the superior meatus حيكون under the superior concha. تمام? So superior meatus بيدخل فيه posterior ethmoid sinus. تمام? Then we have the middle meatus اللي هو underneath, which one? Underneath the middle, اللي هو the middle concha. What goes in there? Everything else. الميدل ethmoidal sinus, الفرونتال sinus, الانتيريور ethmoidal sinus, والماكسيلاري sinus. كلهم بيدخلوا وين؟ في الميدل. تمام؟ So the middle has everything. And then the inferior اللي هو آخر واحد تحت, inferior meatus, is going to have the nasolacrimal duct. Nasolacrimal duct, we said, is in charge of the tears, the drainage of tears. So let's go back to this structure and say them again. On the very top, we said what is this space? It's known as sphenoethmoidal recess. What goes in? What's the opening for which space? For the sphenoid sinus. But then the second one, which is the superior meatus, has the opening for what? For the posterior ethmoidal sinus. Then the middle has everything else, اللي هو الانتيريور ethmoidal والmiddle ethmoidal والfrontal والmaxillary, كلهم وين؟ في الميدل. Then the last one, which is the inferior meatus, has the opening for what? For the lacrimal duct. خلاص? nasolacrimal duct. تمام؟ كده we're done with the openings or the things that pierce the lateral wall. Okay, so here the doctor asked a bunch of questions. Make sure you go through them and use them for revision. I'm gonna post these slides, so hopefully she gets some of them in the exam maybe يعني. So an example of the questions are مثلا which of the following opens in the superior meatus. Okay, and then she's gonna give us like some options. Obviously it's gonna be the posterior لأنه posterior ethmoidal sinus is the only one that opens in the superior meatus. Or she might get the question in a twisted way, which she could ask يعني which of the following opens above the middle cornea. The middle cornea قلنا اللي هي منك اللي في النص صح. So قلنا sink, mink and ink صح. هنا let's draw them. Just remember this small drawing in your head. هنا we have 3 rooms, and then this is the roof. We have 1, 2, 3 and 4. These are the meatises or the spaces يعني. These are the rooms. تمام. For the question says إيش opens above the middle cornea. Above the middle cornea يعني وين؟ يعني حيكون في ال superior إيش superior meatus. تمام. حيكون في superior meatus. So it's gonna be إيش posterior ethmoidal. تمام. So these are the questions she asked. Here also the clinical question. It's very simple and direct as well, you know. So now let's move to the nerve supply. Okay, so for the nerve supply we have 2 types of sensation. We have special sensation and general sensation. What's the difference between them? The special sensation is for the 5 senses. In our case now, because we're studying about the nose, it's going to be smelling. Okay, so the special sensation is for the 5 senses. تمام. And we have the olfactory nerves, which are for special sensation. تمام. Where do they arise from? They arise from the roof of the nose to the brain. This is the olfactory nerves, which are the yellow ones. They arise from the roof of the nose to the brain. Then we're going to move to the general sensation. General sensation like, for example, sensation of dust, sensation of temperature, etc. Okay? So we have 4. We're going to divide the nasal cavity into 4 quadrants. تمام? So we can make it easier. So the nasal cavity is going to be divided into 4 quadrants. This is the anterior surface, this is the posterior surface, and then هنا عندنا the superior والinferior is the oral cavity. تمام? So here we have the cranial cavity and the oral cavity. Okay? So starting off with the anterior surface, we're going to divide it into upper anterior and lower anterior. So for the upper anterior, it's going to be close to the ethmoid bone. تمام? So this nerve supply is going to be anterior ethmoidal nerve. Anterior ethmoidal nerve is going to supply the upper anterior. تمام? The lower anterior is going to be supplied by what's known as anterior superior alveolar nerve. Where does it come from? It comes from the upper teeth or the upper row of teeth because it's close to the oral cavity. تمام? So the lower anterior is going to be supplied by anterior superior alveolar nerve, and the upper is going to be supplied by anterior ethmoidal nerve because it's close to the ethmoid bone. كده we're done with the anterior. Now let's move to the posterior. The posterior, we have upper posterior and lower posterior, just like the anterior. So the upper posterior is going to be supplied by sphenopalatine nerve, and the lower is going to be supplied by greater palatine nerve. So how do you remember this? We're going to remember it by spheno for S. So S superior. تمام? So S superior is going to supply upper posterior. Okay? So sphenopalatine, S for superior, upper posterior nasal cavity. Okay? It's going to supply the upper posterior wall of the nasal cavity. The greater palatine, when we have something big or something great, it sinks down, right? So if we have a liquid and we add something heavy, it's going to sink down. So we're going to remember that greater, because it's big, it supplies the lower posterior. The lower posterior. Greater supplies the lower posterior. Spheno for S for superior, so it supplies the upper posterior. Okay? Okay. Now we have the arteries. We have 3 main arteries that supply the nasal cavities. The nasal cavity واحدة يعني. المهم. So we have the superior artery, the posterior artery, and the anterior artery. So for the superior artery, we have the ophthalmic artery. The ophthalmic artery has 2 divisions or 2 branches. تمام? Here I've color coded them. So the purple is for purple, the maxillary yellow, and so on. يعني. So we said the superior artery, or the most superior artery, is the ophthalmic artery. The ophthalmic artery gives us 2 branches, which are anterior ethmoidal artery and posterior ethmoidal artery. They're just like here, just like the anterior ethmoidal nerve. Okay, same name يعني. Then we have the maxillary. The maxillary artery is going to give us sphenopalatine artery and greater palatine artery, just like the nerves here, okay? Then the facial is gonna give us two branches. The facial artery is oblique in the face, يعني يجي مايل, okay? So it's oblique. So it's gonna give us two branches. One of them is gonna be laterally, so it's gonna give us the lateral nasal artery. The lateral nasal artery. With the other one is gonna be anterior, so it's gonna go to the septum, okay, of the nose, which is known as the middle or the medial wall of the nasal cavity, as we mentioned it above. So it's gonna go to the septum, so it's gonna be named as the septal branch. It's gonna be named as the septal branch. This is a very important branch, although it's the smallest branch, but it's a very important branch. Why? Because it gives us an area known as Little's area. What is Little's area? Little's area is basically زي تجمع كل الارteries في مكان واحد. The meeting point for all the arteries, or all arteries branch out and meet in this area known as Little's area. And this area is caused by the septal branch, which is coming from the facial artery. تمام? So this is the septal branch. It's a very small, we said it's anterior, it's in the middle, so it's the anterior inferior part of the nasal septum. So anterior قدام, inferior على تحت part حق الإيش حق السبتم. تمام? gives us Little's area. Little's area أكثر منطقة معرض, it's the most place that bleeding occurs in, or epitaxis, also known as epitaxis. So epitaxis always occurs in Little's area because it's the area where all the arteries are like branched and all the arteries meet. Okay? Here this is exactly what I just said above, it's the same thing. Then we have the lymphatic draining. The lymphatic drainage, we have two lymph nodes that drain, that are used for drainage. The upper deep cervical lymph node and the submandibular lymph node. The doctor didn't say much about them, she just said this يعني. Then we have a revision for the sinuses. So you can go over this, it's the same exact thing we just mentioned above about the sinuses. So it's about the frontal, maxillary, and so on يعني. كده we're done with the nose. Now let's move to the pharynx. So for the pharynx, we need to know that where does the pharynx arise from, or the pharynx arise from? It arises from, or it starts from the base of the skull. So it starts from the, this is the nasal cavity, it starts from here, the base of the skull, تمام? So it arises from the base of the skull. When it arises from the base of the skull, it goes down up till C6, okay? Cervical vertebra number 6. So it goes up to C6, تمام, here, C6. So it starts from the base of the skull all the way to C6, okay? Then we have to know that it's divided into 3 parts. The first part is known as the nasopharynx, second part is oropharynx, and the last part is laryngopharynx. Nasopharynx, from their names, yani nasopharynx is close to the nasal cavity, that's why it's named nasopharynx, and the oral is also close to the oral cavity, so it's known as oral pharynx, and same thing for the laryngopharynx, it's close to the larynx, تمام? Then we have to know their vertebral levels, or زي ما we studied in the first lecture, the vertebral level for each part of the sternum and all. So now let's know the vertebral level for each part of the larynx, okay? So it's a very easy way to remember. Nasopharynx is the first part, right? So it's the first division, so it has 1C, or one vertebral level, which is going to be C1. But then oropharynx is the second division, right? So we're going to have 2, C2 and 3. Then the laryngopharynx is the last one, which is the third one, so it has 3. So it's C4, 5, and 6. Tamam? Now let's talk about the nasopharynx, okay? So first of all, we need to see the boundaries for the nasopharynx. So for the superior part is the base of the skull. So here we have the base of the skull. This is the nasopharynx. So here it's the base of the skull. Inferiorly, tamam, it's the oropharynx because it's right underneath it, yani. And then anteriorly we have the nasal cavity, and posteriorly we have, as we said, C1, tamam. Now the most important part is the features. We need to know the features of the nasopharynx. So the features of the nasopharynx are the opening of the auditory tube. The auditory tube is the tube that connects the nasopharynx with the ear, okay? So as we know, like for example, when you go on an airplane, your ear gets plugged, so that's why they always say eat anything or chew something, chew a gum or anything. So we open the auditory tubes, tamam? That's the first feature of the nasopharynx. Then we have the tubal elevation. as we know, as we can see here, these are the tubal elevation. They're like going up كأنهم like كده small hills. That's why they're known as tubal elevations. Then we have the salpinopharyngeal folds, okay, which is here number 3. It's like a fold. Then we have the pharyngeal recess and the pharyngeal tonsils. The pharyngeal tonsils are on the top or on the roof of the nasal cavity. So nasal cavity, sorry, of the nasopharyngeal cavity, تمام, or of the nasopharyngeal area. This is the nasopharyngeal area, right? Which is here. It's here. So here on the top we have these are the pharyngeal tonsils, تمام. What supplies all this? What supplies the nasopharynx أصلا? المaxillary nerve. The maxillary nerve supplies the nasopharynx. Okay. Now let's go to the laryngopharynx. As we said, we're gonna skip the oropharynx عشان we're gonna study it in GIT inshallah. So the boundaries for the laryngopharynx are superiorly we have this. This is the laryngopharynx here. It's from C4, so it's gonna be from here till here. This is the laryngopharynx. So superior part is the oropharynx because it's right above it طبعا, and then inferiorly it's the esophagus عشان after C6 خلاص the laryngopharynx continues as the esophagus, تمام. Then anteriorly we have the laryngeal cavity. طيب, this is the laryngeal cavity or the area of the larynx يعني. And then posteriorly, as we had said, we have C4, 5 and C6, تمام. So for the features we have the piriform fossa. What is the piriform fossa? The piriform fossa is a very important site where foreign bodies can get like stuck or can stay in, especially for children, because children, you know, they can eat anything from the floor or whatever, and the foreign bodies will enter their body, so they will look for an area or for a hiding spot. So the perfect spot for the foreign bodies is the piriform fossa. Why? Because it's like a small cave, you know, like it's a small كده حفرة. It will go and stay in the piriform fossa, تمام? And then it will cause infections and so on. So what is the nerve supply for the laryngopharynx? It's the vagus nerve, تمام? So by that we're done with the lecture, okay? One important point or question the doctor said, these are 2 questions doctor said other than the ones on top, was which of the bones, okay, has a part or plays a part in the lateral, medial and superior walls of the nose? It's the ethmoid bone. طيب, for the ethmoid bone, as the doctor said, it's known as the table bone because it plays a role in all of the walls, the lateral, the medial and the superior walls of the nasal cavity. Okay, so by that we've conducted our lecture.